If you're a man over 50, it's time for a frank conversation about prostate cancer. This is a topic a lot of guys like to put off, but understanding the basics could save your life, or at least make things less stressful if you notice symptoms. Let's start with the prostate. It's a small gland about the size of a walnut sitting right between the bladder and the penis. Its main job? Producing the fluid that mixes with sperm to create semen. Prostate cancer usually develops slowly, so you might not notice anything for years. But once the prostate gets big enough to press on your urethra, the tube that carries urine out, you might start to spot a few changes. Maybe you need to pee more often, you feel like your bladder isn't quite empty, or you have to strain a bit. Don't panic. These are more often caused by a non-cancerous enlargement, but they're not something to ignore. So, who's at risk? Age is the biggest factor. Most cases show up in men over 50. It's more common in black men, less so in Asian men, and if your dad or brother had prostate cancer, your odds go up. Recent research even links obesity to a higher risk. Now, about testing. There's no single test that gives you a straight answer. Usually it starts with a blood test measuring PSA or prostate-specific antigen, but PSA isn't perfect. Other things can raise it, and a high number doesn't always mean cancer. If it is raised, your doctor might suggest an MRI or a biopsy to get more answers. If you do have prostate cancer, you might not need treatment right away. Early cases often get monitored closely, sometimes for years. If treatment becomes necessary, options include surgery, radiotherapy, or hormone therapy. Side effects can happen, so your doctor will help you weigh the pros and cons. Remember, most men with prostate cancer live for many years, even decades. And talking about it, whether with your doctor, your family, or other men, really does help. Stay informed and don't put off those conversations. Your future self will thank you.